So I'm here with Christina today, and Christina, we just had, I want to say we just had like our 10-week follow-up, didn't we?
You did.
And what kind of changes? Tell us a little bit about why you came into the office. First, I want to say thank you for doing this testimonial.
Oh, you're welcome.
All right. I appreciate this opportunity to sit down and talk with you. But there's a lot of people out there that are really suffering with thyroid problems and weight gain and fatigue and depression and all sorts of things that are associated with thyroid disorders. Can you tell us a little bit about why you personally came to our office and what your experience has been, and kind of just tell us all
It's
about
been
that?
great. I came, I would say, like 5 months ago, I would say.
Yeah.
I started all of a sudden having symptoms such as, I was full of energy before. I could exercise all day. I could eat whatever I wanted to eat.
Yeah.
People used to tell me, oh, it just comes with age. You just can't tolerate so many different things. Your energy will go down, because I was late 20s.
Yeah.
I just went to one doctor after having, actually, first I noticed my hormones changed.
Yeah.
Like my periods were so irregular, and then my energy was so down. I had mood swings constantly.
Yeah.
I was sad, depressed, and I would be happy, and then I would cry for no reason. I drove my boyfriend crazy, by the way, but anyway. So anyway, I couldn't tolerate so many different things when it comes to nutrition.
Yeah.
I was getting bloated, constipated, nauseated. I even noticed some weight gain despite of exercising and everything else.
Right. Yeah.
So I went out there and looked for help. Being a nurse, I asked other doctors, and they're just, just check your thyroid, that could be the problem. So I did. TSH was slightly, it was actually, when you told me that was actually elevated, they told me it was normal.
Yeah.
But they were going to prescribe me some medications like Synthroid, and I did not want to take it because I look at the patients every day and I see what kind of symptoms they're getting from that medicine. So I definitely started looking on the computer and came across your site.
Yeah.
Actually, I was looking at so many different sites, but yours was kind of like the most interesting one to me, at least.
Yeah.
And I read for so many days, and then finally I emailed, and then your staff, they've been wonderful. They emailed me back, and then I was able to contact you and everything. So one of the doctors told me, oh, you're fine. Didn't even check, just pretty much just main thyroid hormones like TSH. Did not even check T3 or T4.
So you were still suffering all these symptoms, right?
Yeah. So I actually didn't get any help.
Yeah. So you didn't
Nothing.
get any help. Yeah, obviously you came to our office, and then obviously we did a lot of different kinds of tests, didn't we? We looked at
so many that I've never heard of before. And then you tested me for allergies to sensitivities to the foods, and that's when I found out I was kind of wheat intolerant, and so I had to eliminate so many. I thought it's going to be really, really hard, but actually it wasn't.
Right. And so again, after just a few months of care, we actually started seeing some really great, powerful changes in your health in that short period of time. And you've been suffering with those symptoms for how long would you say that you were experiencing those?
Like 2 years, I would say, year and a half, too.
Yeah, so that's longer than anyone should have to suffer with those things. And so how has your quality of life just changed, since you've come to our office? And obviously I know you're very dedicated, from a standpoint of making changes in your lifestyle, your habits, and
nutrition. I feel like I have more energy. I can sleep better. No mood swings after you gave me so many different supplements.
Yeah.
So I've been kind of following the diet and everything. So it helped me a lot, I would say.
So tell us a little bit about, percentage-wise, if you don't mind sharing with us, how much, one of the things we talked about was just the coldness in the extremities.
Oh yeah,
that's
that
a very
was
common complaint for a lot of people who have thyroid problems.
I don't feel like my hands are. I was cold even when it was 90 degrees outside. I would still be kind of my hands, my feet, my back. I would be constantly shaking and cold.
So that's how much better would you say? 95%?
Oh, 95%. Yes.
That's awesome.
Yeah.
That's awesome. And there was a lot of different digestive issues going on as well too. You know, I think at one point in time, you know, on a scale of 1 to 10, you rated a lot of digestive problems as being like a 9. And so
I don't get bloated anymore.
Yeah.
I feel like I can digest. I mean, I don't feel heaviness in my stomach after I eat.
Yeah, and that's so important. And then another big area that, you know, was a concern of yours was what you already touched upon just briefly was just some depression and anxiety. And I mean, that was obviously on a scale of 1 to 10, that was about an 8. And what would you say that is now?
9, probably 9.
So in terms of just improvement wise.
Oh, it's
90% better.
Yeah, 90% better.
90% better. So that's just fantastic. And brain fog too was a big issue too, wasn't it?
I feel I can concentrate better.
Concentrate better.
I work long hours, and I really don't have any problems after working my 12-hour shifts.
Yeah.
I'm still ready to go to the gym afterwards.
Hey, that's awesome. Well, hey, I want to thank you for doing this testimonial for us. What advice would you give to someone who might be, you know, searching on the internet and just, you know, struggling with their thyroid
Just
problems?
don't be afraid. Just don't be afraid. Contact the office. Talk to the doctor, like Dr. Hagmeyer. Talk to him and just don't suffer. I don't think anybody should be suffering. There is help out there.
Yeah, that's great advice too, because you know every day we hear people in the suffering that they endure. And you're right. No one should have to suffer like that, especially when there's an approach that really works.
Yeah.
Okay.
Even though the doctors tell you there's nothing we can do, but there is somebody that can help.
Absolutely. We just got to dig a little deeper, don't we?
Yes. Yes.
Well, hey, thanks again for doing this. We really
You're
appreciate it.
welcome.